Hi, I'm Nicole. I'm your student nurse today. I'm going to wash my hands, provide privacy. Can you please state your name and date of birth for me? I'm looking at the name tag. Perfect. All right, so your doctor has ordered an IV to be put in today, so I'm going to be doing that. I will need to take a look at one of your arms. What I will be doing is looking for a straight vein in your forearm, and then I will be inserting a needle with the needle has a catheter around it, so the catheter will stay in your vein, and I will take out the needle and then cover it with a dressing, and then it will be inserted. Do you have any questions? No? Okay, so what I'm going to do is set up all my supplies. I'm going to wash my hands again. Are you right or left-handed? Right-handed? All right, so I'm going to take a look at your left arm, if that's okay. Perfect. I'm going to put this towel underneath. I'm not going to lie, there probably will be some blood, so if you're okay with that, otherwise I can get a second person in here to help us. You're okay to hold your arm still for me? Yes. Okay, perfect. So I'm going to take a look, find a vein. All right, I found a straight one. So I'm going to wash my hands again. I'm going to set up my supplies. So I'm going to flush this with normal saline. Clean the top first. I'm going to flush it. Okay. I'm going to lock it. Insert that into the package. I'm going to open up my needle. Okay, I have gloves. Need to get some tape. Oh. I'm going to loosen this cap without contaminating. Okay. Got my gloves, syringe, tourniquet. Set that there. Okay, so I'm going to apply the tourniquet, and I can only have it on for no more than 2 minutes. So I'm going to apply it twice. So the first time I'm going to be looking to see if I can get a vein. And then I'll take it off while I prepare the rest of my things. And then I'll put it back on when we're ready. All right, I'm gonna have you make a fist 3 times for me. Perfect. All right, take that off. I'm going to wash my hands. Apply my gloves. Take an alcohol wipe. Clean the area inside to the outside without contaminating it. All right, I'm gonna let that dry, and as it's drying, I'm going to reapply the tourniquet without contaminating the spot that I just cleaned. All right, now it's applied, so we only have 2 minutes, so we'll be done in 2 minutes or less. All right, I'm gonna hold the skin taut. I'm gonna insert 15 to 30 degrees until I see a flash, which I'm not going to right now. Then I'm going to advance 0.5 centimeters further after I go parallel. And then I'm going to sturdy and insert the catheter, or advance the catheter. Gently release the tourniquet. Steadily take out the needle, activate. Okay, not letting go. Oh shoot, this isn't applied. Okay. So I would originally have my saline applied to the lock. I wouldn't have taken that off. But I did. So anyways, I held that pretty sturdily. Sturdy. I'm gonna flush it out. Okay, I'm going to lock it without moving the catheter at all. I'm going to tape down, not taping on the pink part, just in case. We need to switch out the tubing. All right, now that it's secure, I can let go. How are you feeling? Good? Okay. Worst part's over. All right, so now I'm going to be placing this Tegaderm. And I'm only going to place it on the pink, just in case we need to change the tubing. Now I do have some Tegaderm just a little bit over the corner of the tape, which would not happen in real life. All right, so now I'm going to tape this up. All right, I can remove this. Perfect. Going to remove my gloves. Wash my hands. All right, now I'm going to time and date on my dressing. So it's 8. Ooh, what's the date today? I'm just gonna say 4:20. And I'm not sure what time it is, but I'm going to say 20:10. NJ student nurse. Okay. Going to apply. I'm recording myself going to apply that right there. All right. Going to wash my hands. Going to clean up everything. Okay, it's all cleaned up. All right. Make sure the patient doesn't need anything. Bed's lowered, side rails are up, bed's locked, call light is in hand. Then I will go document date, time, insertion part or location, needle and the size, how many attempts it took, how the patient reacted, and then the amount of saline or the amount of flush and what I used to flush. And then a lifespan consideration I could use, if I was doing this on an elderly person. Their skin is very fragile, so I would potentially not use a tourniquet because that could cause skin tears. And then another one could be like the size or the gauge of the needle, depending on the age of the person. Like if it's a baby, obviously you would use a smaller one. And when I apply the tourniquet, I will check the radial pulse to make sure I'm not cutting off any circulation. And I can only keep it on for 2 minutes. And yeah.